When we have aches and pains, a lot of us reach for over-the-counter pain relief medications. A recent USA Today article explains why some men might want to monitor their non-steroidal anti-inflammatory drug intake. The study, reported in the Journal of Urology, states that men who use NSAIDs 3 times a day for more than 3 months are at a 22% increased risk of erectile dysfunction. Ryan Doggett, physician's assistant at Central Florida Pain Management, agrees that regularly taking multiple over-the-counter pain pills daily is not a long-term solution, and that the side effects could cause health risks.
Over-the-counter medications play a huge role even in chronic pain management. Oftentimes by the time we see a patient for chronic pain, they've already tried the over-the-counter medications like Tylenol, ibuprofen, Aleve, things like this, and those have been found to be ineffective for the level of pain that they're experiencing. Looking at over-the-counter medications, basically when it comes to pain meds over-the-counter, really you have 2 basic sets. You've got all your non-steroidal anti-inflammatories like ibuprofen, Aleve, Motrin, things like this, and then you have Tylenol, and that's pretty much it. In older patients, in a senior population, Tylenol is usually your safest option. There are a lot of concerns about using non-steroidal anti-inflammatories with older people because they tend to be harder on the stomach. There is an increased chance of a cardiovascular event occurring like a clot in older populations of patients with non-steroidal use, so we're very careful about that. We always make sure we have a thorough history on the patient before we prescribe a non-steroidal anti-inflammatory to the patient. If the patient's popping 4 or 5 Aleve a day or 6 or 8 ibuprofen a day, that's not something that should be done long term. It has a detrimental effect on the kidneys and could potentially lead to stomach upset and even ulcerations. So if a patient is in enough pain to justify those amounts of over-the-counter anti-inflammatories, then they really need to be evaluated to determine what the source of the pain is by their family physician. If the family physician can't determine the source of the pain, then they need to come see us so that we can try to determine what's going on and treat it better with more appropriate medications.
A 2011 study from the University of Florida raises the concern about potential risks, finding a doubling of deaths from heart attack, stroke, and related events among the people who have both hypertension and coronary artery disease and use the drugs long term. You'll find contact information and past stories for Central Florida Pain Management when you click the over-the-counter pain story link on our homepage at yourhometownhealth.com.